right, it's another Sunday, which means it's another episode of Walk and Talk at the gorgeous San Diego Oceanside. So I thought I would talk about a little bit about avoiding bruising and things that you can do to increase the likelihood of you not having some sort of bruise when you come in to get a procedure with me. And what I find is 90% preparation, 10% is the actual procedure itself. So there are a lot of things that we are either eating in our diet, or we may be taking as a supplement, or maybe using as a medication. A lot of the medications, we just, if they're necessary for cardiac health or overall health, I'm not going to have you stop. So if you're on an anti-platelet medication for that, we're going to work around that. But supplement-wise, I think are really sneaky. I'm on several things that actually make the likelihood of me bruising very significant, and I end up stopping a full 10 days before I am considering either a heavier duty laser procedure, microneedling, or doing any sort of injectable procedure. So what exactly are those? Well, curcumin or turmeric, which is an ingredient in Nutrafol, which I love as a hair supplement, but is no bueno when you think about bruising with the procedure. So you want to avoid that. There are anything that's fish oil and omega-3 in our diet, chia seed and flaxseed, for the same reason. They can actually inhibit our platelets' ability to stick together, which is how we stop bleeding, and therefore you can get more of these purple eggplant bruises that we don't want. And then common things that are pain relievers, aspirin, Advil, ibuprofen, anything in that pain category with the exception of Tylenol. Tylenol's just fine to continue. You want to be careful of that. Of the vitamins, vitamin E, it's a fat-soluble vitamin, and it definitely increases the likelihood of bleeding. And then there's a whole list of supplements that start with G. So ginkgo, ginseng, any of those, they're going to actually increase the likelihood of you bruising. Now, what are some of the things that we can actually do in the clinic? Well, there's a lot we can do. I think keeping you calm. If we keep your blood pressure down and you're not as anxious about something, you feel really confident in the decision that you're making, you're much less likely to bruise, or if you do get a bruise, it's going to be smaller. In addition to that, there are instruments that we use. So administering a little numbing dot with lidocaine and epinephrine at the entry point, I find causes some local vasoconstriction, and I also think that allows for less of an opportunity of a significant bruise. In addition to that, oftentimes we can utilize an instrument called a blunt-tipped cannula. So rather than a sharp needle being used to administer the filler, oftentimes I will substitute out for a cannula. Now, there are some areas that, just for fine-tuning, I think a needle is great, but those are the main tips. I think a lot of it is preparation beforehand. Taking arnica and bromelain, I think, helps with some of the bruising and swelling, so you want to start that a day beforehand. Avoiding the supplements, medications, and even foodstuffs, such as the chia seed and flaxseed, or if you're eating barrels of fish, don't stop eating fish, but just keeping in mind some of that. And then medications, if they're medically necessary, stay on those. We don't want you coming off of that. But if there are occasional pain medications or things that can inhibit platelet function, we want you to stop that a full 7 to 10 days beforehand. So if you thought this was helpful, please let me know. If you have topics you want me to discuss, drop it, comment below. And I hope you guys have a great weekend. And I'll bid you guys goodbye.